Joining us now is American Heart Association volunteer ER nurse and CPR instructor Peter Tharp to walk us through the importance of CPR. Peter, thanks so much for being here, highlighting the importance of heart health here. This terrible thing that happened on Monday Night Football. So important that we all know how to do CPR, and it's very simple, but it's something that we all need to know how to do. Can you talk a little bit about the importance of CPR?
It's super important. I mean, the life that you save could be somebody that you know.
Yeah.
About almost 3/4 of all people that go into cardiac arrest outside of a hospital happens in their home.
What is cardiac arrest? Why don't we start there?
So cardiac arrest is your heart has stopped pumping. It could be for a number of different reasons, weird electricity in the heart, lack of oxygen, lack of blood. But it's when the heart has actually completely stopped pumping, so your body's not getting blood anymore.
Our hearts do this amazing circuit, right? And in just a split second, an impact like what happened with Hamlin there can trigger a problem, can trigger an issue, right?
Yes, very much so, yeah. The important thing is to act quickly after that, and if the heart's not pumping, we have to be the heart's pump,
right,
essentially. And so getting that CPR initiated very quickly is super important to make sure that people survive and have the best chance of recovery.
We're going to do a demo here in just a moment, but I want to focus in on the difference between cardiac arrest and heart attack. They oftentimes get confused, but there's a big difference.
Yes, so cardiac arrest, no heart function, there is no blood going to the body. Heart attack is when the blood supply to the heart, which is a muscle, gets interrupted or gets slowed down, so the muscle is dying. People are often still alive. They'll be clutching their chest,
sure,
you know, pale, sweaty, saying, I have chest pain. Heart attack can result in cardiac arrest, but
gotcha,
usually it doesn't. People oftentimes get to an ER before that happens. Cardiac arrest, though, you're dead,
okay,
so we need to act quick.
And you need to be brought back. We got to get
yes,
that heart pumping again. CPR, we all know what it does, how important it is. What is it? Is it just us getting the rhythm back in? Is it the blood? Is it the circuit? What is CPR?
So CPR, Cardiopulmonary Resuscitation. So what we're trying to do is be an external pump for the body. Since our pump isn't working anymore, we have to be the pump. So
gotcha,
we're pushing on the chest, pumping the blood for the body.
Gotcha.
And we're doing that until people who are more well trained can come to the scene and then fix what the actual underlying problem is, which could be weird electricity in the heart or a number of different problems.
Yeah. So this is something we can do before the ambulance or the hospital gets involved here. So why don't we walk everyone through? You brought some dummies here, yes, for us to walk through. Okay, perfect. I'll come down here with you and walk us through what we need to know. So someone just falls to the ground, like in Hamlin's case. You're there, you're nearby. What's the first thing you do?
First thing is call for help.
Call 911.
Call 911. If there's somebody else around, send them to call 911. Make sure that you tell them, hey, you call 911. Because this day and age, people will start trying to TikTok it, film it with their phone. So
be direct about it. You call 911. I'm going to get to work. Okay, what do we do next?
So what you're going to do is you're going to check for a pulse on the person, kind of in the neck. You can feel your own pulse in the neck. That's what you're going to be feeling for first. If you don't feel a pulse within about 5 seconds, you need to be their pulse, right?
Okay.
So what we're doing is we need to get their clothes off. Our mannequins are not clothed, and we're going to put the heel of our hand in the center of their chest, kind of on the lower half of their breastbone.
Okay.
Reinforce with your other hand.
Okay.
And you're going to try and get as close to the patient as possible. Lock your elbows, and you're going to push down hard and fast.
Okay,
and you're going to do this
about 2 inches?
You're going to go at least 2 inches.
Okay, so we only got about 10 seconds left, but you just keep doing this for how long?
Until help arrives.
Okay, keep doing this about 2 inches down at about this pace until help arrives. All right, and this could save a life.
Yes, the pace you want to do, think of staying alive.
Staying alive. We all know that song. Keep doing it if you see someone in this situation.